A hernia is any protrusion of an internal organ or viscera through the abdominal wall. We should not discriminate children with hernias. They are normal children just like the others, and it's a very easily corrected condition, especially with early diagnosis and early surgery. There's no one particular cause for these hernias, but usually for the inguinal hernias, it's commoner in boys. And this is because this hernia comes as a consequence of there's an opening that connects the abdomen and the scrotum that allows for the descent of the testis. So usually for the boys, when they're in the womb, the testis is in their abdomen. So this testis is supposed to descend down and stay in the scrotum by the time they are born. So the opening through which it passes may remain open after delivery. It's supposed to close by the time the babies are born, but in some children that opening is left open and bowel can follow it, hence forming a hernia. So that's for the inguinal hernias. For the umbilical hernias, you have a natural opening around the umbilicus that during, again in the womb, the bowel tends to come out and go back in. So if that opening doesn't close naturally, you form an umbilical hernia. They can be detected as soon as the child is born or in the neonatal period. And for the inguinal hernias, normally the parent will tell you, or even the physician or the midwives as they deliver the baby will notice a protrusion. And this is usually noted when the baby is crying or when there's an increase in the abdominal pressure. So like when they are attempting to pass stool or pass urine. But most commonly when they are crying or they are in distress, you'll notice a swelling or a protrusion in the groin or in the umbilicus. These hernias are done as an elective procedure, and they can be done as a day case. That means you can come into hospital in the morning, get the procedure done, and ideally go home by evening after a period of observation. Normally, after the surgery, you will get a wound in the inguinal region, and the scar is usually about 2 to 3 centimeters long. It usually heals quite well. We put a dressing on the wound. Normally the dressing will be removed after 3 to 5 days, and within 5 days the child is up and about. The main thing to look out for post-operatively is usually pain in the initial period. You may have some wound complications where the wound might either get infected or gape a bit, but it's not common. The other complication that you may see is you may have problems with the testis, especially because these hernias in boys sometimes come with an undescended testis. So as we fix the testis, as we repair the hernia, you may have complications associated with the testis. But again, those are quite rare. So normally within 24 hours, the child can feed. They are normally able to feed. They can sit up. For the school-going children, once the pain is controlled, they'll just be up and about by the second and third day. And with the swelling, you may get a bit of swelling around the scrotum, especially if we have to fix the testis. But this swelling goes away within 1 to 3 weeks after surgery. I would just like to advise the general public that hernias are fairly common and quite easily treatable, especially if managed early. And also because they come with undescended testis, it is very important that we put the message out there that the earlier we repair or we fix the undescended testis, the better. So we want to fix this testis as early as 6 months after delivery because of the issues to do with infertility and the risk of future testicular cancer. So it's very, very important that if you have a child whose testis is not in the scrotum, seek early care and early review by a surgeon.